And welcome. Thank you for joining me for episode number 4 as we're discussing this fabulous article in the Journal of Psychiatry by Skuman and Vokes on removing the stigma in ADHD. So please, let's remove the stigma, and the best way to remove stigma is by sharing knowledge. Let's share knowledge. Mensa and Stellenbosch University and Skuman and Vokes have done a fabulous work of doing this research and then publishing this wonderful journal article, and I'm reading out huge extracts from this, so please join me. This is episode number 4. The methods that we used, we spoke about the purpose behind the study and what the methodology. So the methods that we used, a convergent. So please just focus, although I know I'm going to try and make it as simple as possible for the academic purposes. So if you don't understand some of the words, ignore that, but try and extract the fabulous words of wisdom that are contained in this article. A convergent parallel mixed methods research designed, consisting of a quantitative survey and an in-depth interview component, was conducted to explore the lack of knowledge about ADHD and stigma as potential barriers to help-seeking behavior, diagnosis, and treatment for children with ADHD. Participants were recruited from 6 schools in which the Goldilocks and the Bear Foundation, of which Tony Vogus, Goldilocks and Bear Foundation, I think she's the original founding member from the Department of Psychology, Stellenbosch University, and the articles are written together with Skuman from Bellevue in Cape Town. Dr. Skuman, Professor Skuman, I'm not too sure. So participants were recruited from 6 schools in which the Goldilocks and the Bear Foundation is active in delivering mental health services to well done to Goldilocks and the Bear Foundation in delivering mental health services to underprivileged children with the aim of removing mental health barriers to education. In these schools, 451 children were screened by the organization for the presence of emotional, behavioral, or learning disorders. The parents of these 451 children were invited to participate in the study. Furthermore, the 163 educators at these schools were also invited to take part. A total of 26 parents and 19 educators completed the questionnaire about the barriers to access to care. This represents a response rate, I'm rounding off the figures. This represents a response rate of 6% of parents and 12% of teachers. Of these, 12 parents and 6 educators agreed to take part in a telephonic interview to gain a deeper understanding of the experiences regarding ADHD and the stigma in the community. The data collection. All participants completed the Barriers to Access to Care Evaluation BACE-3, originally designed by Clement et al. The BACE 3 is a 30-item self-administered questionnaire and explores stigma-related barriers such as anticipated discrimination, social stigma, disclosure concerns, stereotypes, internalized stigma, and stigma by association. Semi-structured telephonic interviews were conducted in September and October 2020. 3 open-ended questions were posed to participants. Questions were related to parents and educators' understanding of stigma and their experience of stigma in relation to ADHD, and these aimed at gaining a deeper understanding of how stigma acts as a potential barrier to accessing care. All interviews were recorded once respondents had given permission for the recording as specified in the ethical procedures for the study. It's well done to the researchers, keeping to the ethical and moral and high standards. Very good, well done. I always look for academic. You must have high standards of academic research. Well done to the researchers in the study. So the results and discussion. 45 participants completed the BACE 3 questionnaire study. Participants were on average 40 years old with ages ranging from 22 to 64 years. I'm 64, so it will also include my age group. Alhamdulillah, very good, well done. It's a nice broad range. That means you included the parents and the young people as well as the grandpas. The opas was me. Ek is a lekker old opa. I'm old, I'm cold, but always say, must always have a heart of gold. Lekker mensa. So one of the participants had no formal education. 9 had completed matric and 25 had some or completed their tertiary education. So well done. So we've got a broad range of people, from those who did not complete their matric to those who've got advanced tertiary degrees. Well done. So it's a nice range of research participants. Well done to the research team. So 12 participants were unemployed. 10 participants report. Now look, imagine they're unemployed and they've got children with ADHD in the home. We cannot imagine the trauma. So firstly, you're unemployed. We've got South Africa got the highest unemployment rate in the world. So you're unemployed, you don't have a job, and you got an illness in a house. Very, very traumatic, very, very sad. So let's help. The last thing you want in life, you don't want stigma and people pointing fingers at you. So 10 participants reported that they had been diagnosed with a mental health condition, of which 7 indicated that they had been diagnosed with a mood disorder. Okay, so it's seemingly running in families, or maybe it's a complex multicultural thing because it's a family, it's a children, depression, anxiety, everything comes together. They say, elke huis het sy kruis. Every house has got its burden. Only those people who are going through suffering, they know what they are going through in that house. Elke huis het sy kruis. Nee, mense. So 17 of the participants, that means 38% of the participants, reported that their child had been diagnosed with a mental health condition, of which 14 were diagnosed with ADHD or without comorbid psychiatric disorders. The base clusters barriers to care into 3 groups. There were 3 groups, okay? First is the instrumental barriers, the attitudinal barriers, and the stigma-related barriers. The instrumental barriers refer to practical and logistical factors that prevent people from accessing care, for example, lack of financial means or transport. Attitudinal barriers refers to misconceptions that discourage individuals from seeking help, such as the belief that medication is dangerous. So then they will go to the sangomas and the spiritual healing and herbal medication, all the other witchcraft and all of that. And then there's a stigma-related barriers, refer to perceived public stigma and the resultant self-stigma, for example, concerns about other people's opinions on the individual receiving a diagnosis or seeking treatment. The most frequently reported barrier was not being able to afford the financial costs involved in accessing treatment, which represents a huge instrumental barrier to care. This was followed by participants wanting to solve the problems themselves. Sometimes there's a shame related to it. So they say, we don't want to tell anyone, keep quiet about it, keep quiet. How it's going to affect the future? How are they going to get married? So many times it's out of shame and ignorance. So they don't tell anybody. They don't want to talk about it. They say, shh, shh, don't tell nobody. Shh, don't tell nobody. This was followed by participants wanting to solve the problems themselves and concerns about the treatments available, which both represent attitudinal barriers. We don't blame people for their cultural values. Are very, very important, especially in the Indian community, the traditional Black Afrikaner community, and the Chinese community. Family values, and the Italian and Greek communities, family values are very, very important. And the Portuguese. Concern that the participant or the child may be seen as weak for having a mental health problem was the most frequently reported stigma-related barrier. Stay well, look after yourself. See you in episode number 5. Alhamdulillah.